Actually, me and my woman here, we didn't plan in having family planning though.
Hey, y'all, come look at this.
I think like we are trying to have like 12 kids.
The Nigerian government had made a 97% reduction in the national family planning budget. These moves come at a time when donor funding for such programs is also declining. Family planning is crucial for reproductive health, maternal well-being, and controlling population growth. We are out here to ask Nigerians what their thoughts are about this recent development.
Yeah, actually, me and my woman here, we didn't plan in having family planning though. I think like we are trying to have like 12 kids. Yeah, three. I'm sorry, six. Six girls, six boys. But though, let me just put it straight. Family planning, cutting it down, is going to affect a lot of people, especially those who wants to go into family planning and maybe they don't have the people who are supposed to guide them around them, and even maybe some people want to go into family planning as well, and let me say they can't meet the cost. So you see, government cutting it down is going to affect them seriously.
Well, actually, it's not only the family planning budget that it was cut. There are some other budget that was cut, and but the economy for now in Nigeria is something that we cannot talk about it as much as this regime is concerned. So I just want to briefly say the cut in the family planning budget will affect Nigerians seriously, because now they have to what government is supplementing for the family planning was cut off. So we have to use our own resources to go for family planning. That is what.
What the government is supposed to do is to even increase the funding, especially this economic hard time in Nigeria. Because if the government don't increase the funding, it will really affect the population. There will be mass growth in population, and when the population is growing and the means of taking care of the population is not there, it can even lead to infant deaths, because most children will die because of they are not taken care of adequately.
As long as I'm concerned, I don't believe that that phrase, family planning, is practically in operation in Nigeria. If it is, I don't think so. Or if it is, I believe that it is one-sided. Because if you go to the north, is still an issue. An issue because people are still into uncontrolled, what do I call it? Pregnancy and delivery. Uncontrolled kind of family life issue. See men marrying, even if 100, they are happy that they are marrying 100 and producing 1,000 children, and even without knowing how they are going to survive. Some men don't even know the faces of their children, as long as so many Northerners are concerned. So if we talk of family planning in Nigeria, it has not really taken roots. It has not really affected lives. So if there should be an avenue for federal government to cut a kind of sponsorship, that it will not have any impact, because all this while they have not done any cuts. I have not seen any effects.
I know Nigerian governments all over the years, they are good in forming policies, but what matters most is the implementation of that policies. What you told me now, I'm not even aware, and I know so many Nigerians are not even aware of the program you're talking about, and which amount of money has been budgeted for that. Now, how are we sure that that money they budgeted will go to that particular program? That it will not just go like every other program. Let me give you a typical example. National Health Insurance. If you go to hospitals, you discover that many times when they prescribe drugs, they tell you they don't have it. And that is the end of it.
Nigerians have shared their thoughts. It is evident that family planning services play a vital role in our society. With this decision, it is essential to consider real-life implications on everyday Nigerians. Stay tuned to Premium Times for more updates and engaged information. Thank you.